Critically ill patients can now move to the front of the line to get medical marijuana.
Today, Governor Cuomo signed a bill giving patients emergency access to the drug. Now, it hasn't been available to anyone since the bill was passed last year. News 4's Jen Shantz is in the newsroom with all the details. Jen?
Well, Donna and Alina, the bill got a thumbs up from both houses in the legislature back in June. Now, after a green light from the governor, patients with progressive or degenerative conditions can bypass certain red tape. That means the Department of Health might need to register additional organizations to produce medical marijuana as soon as possible and waive certain regulations, such as allowing the state to acquire medical marijuana from outside New York. This new expedited program is entirely separate from the state's medical marijuana program, which is expected to be operational in January. With this new expedited program, patients who qualify will be issued cards that grant them access to medical marijuana legally and as soon as possible. Deputy State Director of the Drug Policy Alliance, Julie Netherland, says for those benefiting from Cuomo's signature today, the clock is ticking.
The idea here is to help those patients who literally could die without medical marijuana. And the main group that we're really focused on are children with very severe forms of epilepsy, who have sometimes dozens and dozens of seizures a day. And this group is really at risk. In our campaign alone, since the bill was signed in July of 2014, there have been 3 children with these severe forms of epilepsy who have died.
That includes 9-year-old Anna Conti of Orchard Park, who passed away in July last year. Her family was in strong support of the medical marijuana bill when it passed. Coming up tonight at 6, a look at the original program and why some say the reins are still too tight. In the newsroom, Jen Shantz, News 4 at 5:30.